In this part of today's session, we are going to be demonstrating the core assessment on the dynamic system. I have a 58-year-old patient here with me, and we are going to demonstrate the sensory organization test, motor control test, adaptation test, and the limits of stability test. The first thing I'm going to need to do is put a harness on her. So we're going to demonstrate the application of the harness. It goes on like a vest. And turn around and face me. We're going to cinch up the center strap first. Goes through the big part of the buckle and then the small part. All right, we'll get that just about at her waistline. There's two leg straps. Each one goes underneath and cinches up to the strap on the other side. We're going to hook these up loosely at first. Thank you. All right, so I'm going to cinch up the waist strap first because I've got that in a good position. I'm going to lift up on the D-ring and pull down on each of the shoulder straps to make sure those are nice and tight. And then I'm going to lift up on the leg strap and pull back down to make sure each one of those is nice and tight. And that looks really good. To check to see if I've got it snug enough, I just lift up on the D-rings to make sure there's no extra space and room there. Looks good. All right, climb up here for me. We've got Mary's file already on the system. So we're already ready to run some tests for her. We're going to hook her into the system with these D-rings. All right, these carabiners here. You want this vest, the D-ring on the top of the vest, and the carabiner, if it's sitting on her shoulder right there at the top of that D-ring, and the carabiner is horizontal, that's the proper position for each one. In this position, the patient that you're testing has enough room to sway forward and backwards without the harness catching her at her limit of stability. All right, and we can tuck the straps in or just get them out of the way so she doesn't hold on to them. She shouldn't be holding on to straps during the testing. I am going to set up the menu now to show you the tests we're going to be running today. On the main menu, I'm choosing dynamic conditions on the screen. I'm going into assessment, and it's asking me if I've loaded the correct patient. I click yes. Under assessment, I have a choice of tests to perform. Today, we're going to do the sensory organization test, motor control test, adaptation test, and limits of stability. And you'll notice as I click on these tests, they show up in this order. That's the order we'll be performing them today. All right, so clicking on continue allows me to progress to the first test. Under the menu, you will be told how to align the patient's feet on the force plate properly for each test. This is normed to the patient's age and their height on this one, so that you have a wide enough foot placement for comfort and a standardized position. So this tells me to align the patient's feet with their medial malleolus to the center horizontal line and the lateral calcaneus, the lateral part of the heel, to the M line. So I'm going to help you adjust your feet in a really specific position. This bone right here is going to be on that wide black line right there. And now I've got the outside of her heel on the M line. We're going to do the same thing over here. Thank you. Alrighty. Now, if you feel like you have too much pigeon toe, you can rock back on your heels and just splay your feet a little bit and turn them out, as long as your heel stays in the same spot. So we want a standardized foot position so that when we do testing and retesting, we've got the same position for each patient. Clicking on continue gives me the screen that we're going to be seeing. I'm going to turn this on for you, Mary, just for a second to show you what we're doing so you understand this test. During this test, there's going to be 6 different little tests on the sensory organization test. Under 6 conditions, you get 3 tries at each of those tests. They start off kind of easy, and they get a little bit harder each time. During this test, sometimes I'm just going to have you stand there with your eyes open and do nothing. Other times the walls might move, and sometimes the floor might move. So if the walls or the floor move, anytime anything moves around you, your job is going to be to stand as steady as possible, all right? So each trial, each little test only takes 20 seconds. During that 20-second trial, I want you to stand really steady, arms relaxed at your sides, down here, not holding any straps. You can look forward at anything. I'm going to turn the screen off. You don't get any feedback on this test. Try not to talk. Try not to scratch your nose or fix your glasses or anything, okay? So during the test, stand as steady as possible. In between, you can fidget a little bit, okay? All right, so we're going to start off really easy. Yep, turn that off for me, thank you. We're going to, on condition 1, nothing's going to move. All right, so you're just going to stand there with your arms relaxed, as steady as possible. Testing you now. Okay, so Mary's in this system. She's got her eyes open, and she has all 3 sensory systems available for balance. She's got vision, vestibular, and somatosensation, the feeling around her feet and ankles. Nicely done. Okay, you get 2 more just like that. Okay, starting now. So with all 3 of those sensory systems available for balance, we expect that our patient will be, their nervous system will default to using somatosensation, which is the feeling in the feet and ankles and the lower extremities, to be able to balance. She's doing very well. She got a little bit low on that first one. You feel okay in there?
Thank you.
All right, and one more just like that. Testing now. All right, and the surface here is firm. It's bigger than her feet. It's not moving. It's very predictable, so she should be able to use her somatosensory system very strongly for balance and postural control. Nicely done. All right, on condition 2, we're going to do the same thing, but this time you're going to do it with your eyes closed. So I'm going to tell you when to close your eyes and when it's okay to open them up, but I want you to keep your eyes closed the whole time. If you have to open your eyes for any reason, you let me know. Okay? All righty, here we go. Close your eyes and testing. Steady as possible. Okay, I can also see from my center of gravity alignment part of the screen here that I have her lined up very nicely on the force plate. As a clinician, try not to cough. All right, sorry. So she coughed during that session, during that test, so I'll probably want to go back and redo that one. It's actually showing up that she did pretty well there, but since she coughed, I'll see how she does through the rest of it. We may want to go back and redo trial 1 of condition 2. All right, Mary, close your eyes and testing. All right, that was better. Open. All right, and one more time just like that. Get ready, close your eyes, and testing. So now she's in the same condition for the feet. The floor is stable. Now I have her closing her eyes, so she no longer has vision available. She should still be using somatosensory input for postural control. Mary, we need you to stop fidgeting here a little bit. All right. Let's see what happened here. All righty. We're going to move on to condition 3. She's a little fidgety, so I'm going to try to keep her steady. The more your patient moves throughout the test, the more it decreases the score on the equilibrium score. Even those little movements in posture can actually affect this score. All right, so stay as steady as possible. This time, what's going to happen, you're going to keep your eyes open, but the walls might move. Okay, the walls might move. starting now. Okay, stay steady. Okay. All right, so you want to think about why the walls moving might affect someone's postural control. That was good. A little harder, huh? All right, one more time, 2 more times just like that one. Get ready. Walls might move, starting now. Stay up, come back to center. Get your balance and testing. All right, so now the floor is still the same. It's not moving, but now when we add this condition where the walls are moving around her, she has to disregard all of this visual information that could be occurring and focus on the sensory input from her feet for balance. All right, good. You okay?
Yes.
That was good. That was better. One more just like that. Eyes open, walls moving, starting now. All right. Some people have a difficult time trying not to pay attention to that visual input. They trust vision too much. And those are the people who sway a lot. You'll notice she swayed a lot on her first trial of this condition. And now she's figuring out what to do. Okay, fidgeting is okay. In between, nicely done. All right, on the next 3 conditions, Mary, the floor might move underneath you. So your job is still going to be to stay as steady as possible with the floor moving. The first test under the floor moving conditions is with your eyes open. Okay, so keep your eyes open. Floor might move, starting now. So now what we've got, her eyes are open, but the surface is starting to move. The surface moves when she moves. This is called sway referenced, just like the walls moving. Anytime she moves her body back and forth or starts to sway, the floor will move with her. All right, same thing again, nice and steady. Floor might move, starting now. Okay, so if the floor is moving and it's moving with her, that means she can't really use proprioception and her sensory feedback from her feet and ankles. Excuse me. Her body should automatically shift to using vision for balance since her eyes are open. Good, a little bit better. All right, nice and steady. One more time just like that, okay? And testing. Mm-hmm. All right, the vestibular system is still active and working. We really can't turn that off. So that comes in as a second sensory input after vision in this condition. But this condition really pushes the use of vision for postural control. All right, Mary, you're doing good. Getting a little harder now. On condition 5, you're going to do the same thing. The floor might be moving underneath you, but I'm going to have you close your eyes during the test, okay? So I'll tell you when to close your eyes and when it's okay to open them up again. Try to keep your eyes closed the whole time. If you open them, let me know, okay? Because I have to stop the test. Get ready. Close your eyes and testing.
Oh, I opened my eyes, sorry.
Okay, so she touched the wall and she lost her balance forward. So I have to stop the test. I just click the mouse button here to stop the test. Get your balance, nothing's going to move. And on the screen I have a choice. I can either discard that trial and redo it, or I can mark it as a fall. And since I really want to capture her deficits, I am going to mark that as a fall. So I'm clicking here. The next thing I'm going to have to do is make sure her feet are positioned properly on the force plate, because that's going to be critical. She didn't step. She just took a forward lean and touched the wall, and her feet look like they're in the same position. So I'm just going to click the feet are okay. And we get to continue the test on to trial 2 of condition 5. All right, you get another 2 tries at that one. Let's see if you can do it this time. Okay, get ready. Floor might move. Close your eyes. Testing now. I have a little hook on the back of the harness here in case I need to catch her in the event she takes a step or falls, but the harness will also catch her if she goes beyond her limit of stability. Nice job, good job. All right, open. And I sometimes put a hand on their shoulder if they sway a lot, just to kind of keep them grounded, get the patient back to their centered position. All right, much better, nicely done. Okay, you get one more try at that one. Get ready, close your eyes, and testing. Under this condition, the floor is unstable, so she can't use somatosensation. Oh, we did it again here. Okay, come back to center. I'm going to mark that as a fall. And I have to take a second to reposition her feet because she scooched her foot back a little bit. Okay, scoot this foot forward again. We're going to put it right back where it was before. In a little. That foot looks okay. And you can turn your toes out just a little bit. Scoot this ankle in a little bit for me. Oh, backwards. There we go. All right, that's important to get the most reliable results that we can.
Do we have to do that one again?
Nope, we're going to count that as a fall, and that'll average into your total score. Okay, you've got some good ones, and we're actually finding the problem, where your problem is. This condition, under condition 5 that she just finished, the floor is moving, so she really can't use somatosensory input for balance. Her eyes are closed, so vision is unavailable for balance. And the only reliable sensory input is her vestibular system. So if she has a vestibular pathology, or if she's not using her vestibular system well for balance, she could fall or perform poorly on that condition. You'll notice the conditions where she swayed a lot more, where her postural control decreased, become these red bar graphs. And the red lines mean that we have an impairment there under that condition. All right, Mary, we have one more test to do on sensory organization test. This time you're going to keep your eyes open, but the walls and the floor both might move. All right, so your job, stay as steady as possible, even if things are moving around you. Eyes are open. Walls and floor might move, starting now. Okay, same condition for her feet. The somatosensory system is disadvantaged here. She's got vision available, but she's got incorrect visual inputs, nicely done, because the walls aren't giving her any help. If she trusts vision, she'll think she's standing steady because the walls are moving with her. And the vestibular system has to really, really work hard under that condition as well. You okay? All right. Same thing again. Stay as steady as possible. Testing now. Okay. Try not to help your patient. Be there if they need you, but certainly don't help them. If you touch the patient or if you catch them in some way, you need to stop the test. Maybe redo that trial as an operator error. Good. All right. One more time. You're going to make it?
I think so.
Okay. All right. All right. You okay?
Ready.
Get ready. Eyes are open. Testing now. Okay, so this condition 6 becomes another condition that really forces her to use her vestibular system. So if she has some inability to use those vestibular cues for balance, that may be a reason why she's performing as she is. Lots of sway, a lot of struggle to get finished with this test. All right, so I'm going to close out this test now, and we're going to go on to the motor control test. Okay, the motor control test is a test that measures long loop postural reflex activity in the nervous system. Since we know how fast information travels in the nervous system, we should be able to capture that latency on a perturbation type of test. So what's going to happen in this test, Mary? Let me tell you what's going to happen. You're going to stand really steady again, and your job is going to be stand steady, don't move, no fidgeting during the test. The force plate is going to move forward very quickly or backwards very quickly. It's kind of like someone's pulling a rug out from under you, but it's going to start really small 3 times in a row, then medium ones 3 times, and then some big ones 3 times, all right? Your job, stand as steady as possible. I'm actually going to check her feet one more time. Foot position on this one is critical. She's in bare feet, which is also very, very important for the motor control test. You do not want her feet slipping on the force plate at all. So her feet are in a good spot there. All right, relax your arms. All right, you are going to get a tiny little translation of the force plate coming backwards. It's really small. Once it goes 3 in a row. Okay, here we go, starting now. That's all it is. And you get 2 more just like that. All right. Now we've got medium-sized ones going backwards, starting now. Very nice. So she gets a stretch stimulus when the force plate moves backwards, and she has to create a motor response to maintain that stable posture. So what the force plate does is it measures the time between the stimulus and the response, and it captures that latency, which is really important. Okay, the force plate's going to move back big translations 3 times in a row, starting now. Okay, that's a normal response. Get 2 more like that. Good. Good job. All right, so this tells us something about her baseline level of the nervous system. I can tell already that she is reacting within 120 milliseconds. Most people are going to react well under 160, around the 150 millisecond range. So she's got really good postural reflex activity. So that tells me something about the afferent and efferent long loop postural reflexes, and even the integration in the spinal cord, that those pathways are probably intact. She's able to use them quite well. All right, we're moving on to forward translations now. Feet are still in the same spot. You're going to get the little ones going forward 3 times in a row. Okay, here we go. Starting now. Okay. Okay, medium ones forward. Testing now. Okay, when the force plate moves forward underneath her, it creates a situation where she has to use her anterior tib, her hip muscles, her abs, her neck flexors, and all her flexor muscles in the front of her body. When it moved backwards, it creates a situation where she has to use plantar flexors, hamstrings, hip extensors, back extensors. So we're going to see different performances on different patients depending on their pathology. Okay, big ones going forward, starting now. Good. Try not to touch those walls. Good job. You okay?
Fine.
All right. She got really good scores on this, so that helps me understand that her motor system, her reflexive motor responses are actually very intact. We've got some numbers in her analysis that are kind of low computer competence. So I'm going to have to go in and mark some latencies later or just check them to make sure that they're the appropriate scores. We get scores from 0 to 4 on each of those trials, and that way we know whether we've got a good good technical performance for her on that test. All right, we've just completed the motor control test, and we're moving on to the adaptation test. In this test, Mary what's going to happen is the floor is now going to rotate. So it's either going to go toes up or toes down. All right, when the first plate rotates toes up, it's going to go 5 times in a row, and each one is exactly the same. And then it'll stop, and we'll do 5 times toes down. Your job again, stay steady. You don't get to hold on to anything. Relax your arms, and try not to let it knock you forward or backwards. Just stand as steady as possible. Toes are going to come up quickly, starting now. Good. Okay, it comes down kind of slow, so just write it down. And you get 4 more, and they're all exactly the same. Good. All right, so what we want to see on the adaptation test is if someone is given a problem, 5 times in a row they get the same stimulus to solve that problem, and they have to keep posture, their first reaction is often very large. So you'll see when you see the screen here or the printout, there's a lot of room for error on the first trial. And then it should get better and better and better as the person's nervous system gets used to that. They adapt to that stimulus and they do better each time. Our patient here kind of figured it out how to do it the first time, and she's sort of flattened out across the board, and that's fine too. That's what we see a lot in the results. Good job. All right, now it's going to go toes down 5 times in a row. Get ready, and testing. Okay, so you have to hold steady as possible. If she has a lot of forward and backward sway, and her score might be up in this gray zone here. If she is within a reasonable amount of sway distance, sway energy, if she's using enough, a reasonable amount of energy to keep her posture, her score will be green, these little green boxes. If she falls, then you'll see falls at the top here that indicate that she was unable to maintain posture in that balance in that condition. Doing good. One more time. Nicely done. Okay, this does take quite a bit of ankle range of motion and some ankle strength. So we do know something about her ankle biomechanics even from doing the adaptation test. All right. Nice job, Mary. We're going to take you out of there now and move on to the limits of stability test. We've just completed the sensory organization test, motor control test, and adaptation test on the dynamic system. So we're actually going to have Mary do the limits of stability test on the static system, static force plate. So on the main menu, I need to click on activity-based in order to toggle to this long force plate. I'm going to click on assessment and load the limits of stability test, continue, and that will give me the setup command for her foot positioning. So Mary, I'm going to have you stand on this. It was just the same position we had you on the dynamic system. I want you to put the arch of your foot over those little circles to start with. This medial ankle bone is going to be on this wide black line, and your outside of your heel is going to be on this M line. So move that foot out a little for me, and this one goes a little wider as well. Okay, if you want to rock back on your heels and splay your toes a little bit and scoot this foot forward just a tiny bit. Very good. All right, she looks pretty good to me, and we'll check her center of gravity position once we start the test. So if I click start, I notice that she's back a little bit. I'm going to have you try to get that little neuroman in the box. Do you still feel straight?
Yes.
Okay, so she feels like she's in midline, and she looks midline position to me. So Mary, on the limits of stability test, what we're going to do here is have you start in the center circle. This little neuroman is your center of pressure on the force plate. I want you to lean forward and backwards a few times for me. Good. Put some weight on your toes, weight on your heels. Put some weight on your left foot and your right foot side to side. See how that makes it move around? Your job is going to be to start with that little neuroman in the center square. And then when you see this blue circle, highlighted in the yellow square on any of these 8 outside squares, you are then going to move quickly and directly towards that target and stay out there for as long as you can till that little yellow block goes away. All right? So your first job is to stay as steady as possible in that center square. All right? I'm going to stand here and make sure you are safe. All right, we're going to click when I click the start button, there's a 2-second delay, so I can't say go. I'm just going to say hold steady and go. Good. Try not to lift your heels up. Just go as far as you can. And now come back to center. That was nicely done. All right, so we want the patient to lean as far as they can without taking a step. All right, clicking start gives me that center target again. So line yourself up at the middle. Stay right there. Hold steady. Oops, that was me. I'm going to discard that one because I clicked twice on the mouse. All right. Get back in the center target and hold steady. Go. Good. She's putting a lot of weight on her right foot up towards the toes. It looks normal, looks really good. All right, that was 2. It's going to move around the circle, so you have 8 total. Start in that middle box. Get right there, hold steady. Whoops, that was a little too soon. So I think she jumped the gun on that one. If she was outside that center square when the test started, it's probably going to throw out the data. And it does. So now I'm getting a message that says her initial holding position was outside the center box. So I want to repeat that trial. I'm going to click yes and give her another chance on that one. So it automatically defaults back to that 3rd trial, and I'm going to redo that one. All right, so stay in the center box right there. Get back in there. Hold steady. Go. Good. Stay out there. Hold it there until that little timer bar goes away on the bottom. Very nice. All right, starting in the middle again. Hold steady. And there we go. Backwards, put a little weight on your right heel. You can see she's trying really hard and kind of rotating a little bit. That's fine. That's her choice. I want to watch her strategy to make sure to see if it's successful or not and efficient. All right, center target, hold steady, hold it right there. Go. Okay, she should be keeping her feet down on the force plate. All of the normative data was collected with the feet flat on the force plate, so I don't want her to lift her heels or her sides of her feet up at all. Okay, back to center. Hold steady and come towards me. Good. Good job. All right, back to the middle position. Hold steady right there and go. Okay, she's giving me a good effort, so I know she's giving me a good test. And you have one more condition. This one's going to be forward to the left. Hold steady and go. Great. All right, hold it right there. So now she's just completed the limits of stability test. The sensory organization test gave me some information about her use of sensory systems for balance. The motor control test gave me an idea of how she is able to use her long loop postural reflexes. It tells me something about the integrity of her nervous system, especially the lower extremities. The adaptation test tells me how well she adapts to surface changes and perturbations in the floor. And this test rounds out that core assessment and tells me something about her ability to use voluntary motor or cognitive control of her own movements, and how far she can move, how smoothly she can move, how quickly she moves, and how steady she is in weight shifting.